We hear it every single day. The U.S. fiscal path is unsustainable. America is, deep in the red. We're carrying a national debt that's blown past $35 trillion. And the political finger-pointing, it's just constant.
Right.
We're always told the villains are obvious, unsustainable entitlements, sweeping tax cuts, and, of course, costly foreign wars.
And that's the default framework, isn't it? It's the conversation starter in Washington.
It is.
And that standard framework, that the problem is really one of political choice, that we just spend too much or we tax too little, that's dominated for decades.
Right.
But the analysis we're diving into today, it's known as the Taproot Model, and it fundamentally challenges that entire idea.
How so?
It argues that the conventional wisdom isn't just, a little bit incomplete, it's completely incorrect.
Wow. Okay. That's a pretty powerful assertion. I mean, especially when every established economist seems to agree on those usual suspects.
It is.
So if we don't have a sovereign debt crisis that's driven by our political choices, then what do we have?
According to this analysis, the U.S. doesn't have a sovereign debt crisis at all. It has a pricing crisis disguised as a debt crisis.
A pricing crisis.
A pricing crisis. And the mission of this deep dive is to present the evidence that excess healthcare pricing, not traditional government spending, is the real structural driver of the vast majority of our national debt.
Okay, to back up a claim that the methodology has to be really rigorous. So how did this Taproot model even approach that?
The methodology was meticulous. They rebuilt the U.S. federal budget data all the way back to 1970.
From scratch?
From scratch. And they isolated just one variable, federal healthcare spending. And then they asked this fundamental counterfactual question.
Like was?
What would the national debt look like if government healthcare spending, so Medicare and Medicaid, had just tracked general inflation plus population growth? They wanted to find the true taproot of the problem.
So the idea is to strip out the cost of every war, every tax cut, every stimulus bill, and just see what the debt curve looks like if only healthcare costs behave like, normal stuff.
Precisely. And the results are, well, they're stark. The analysis finds that if healthcare prices had behaved in line with the rest of the economy, the United States would have virtually no national debt today.
Wait, no debt?
Practically none. Instead of staring down a $35 trillion problem, we'd be sitting somewhere in a range of, say, $5 to $9 trillion. Totally manageable.
Okay, let's unpack this.
Yeah.
That suggests that the other $26 trillion is a fiscal hole dug by just one single sector.
That's right. And that $26 trillion, it isn't government waste or runaway entitlements in the way we usually think about them. It represents the cost of a structural market failure, a premium, really, that has silently decoupled the price of medicine from economic reality since the 70s.
Okay, before we just accept that, we have to look at the numbers that we do accept. When experts talk about the debt explosion since 2000, they always cite three huge events.
The usual suspects.
The usual suspects. Let's review those first.
Okay. Suspect number one. The post-9/11 wars in Iraq and Afghanistan. If you include long-term veteran care and interest, that's roughly $8 trillion in new debt.
Okay, $8 trillion. What's number two?
Suspect number two, the big tax cuts, specifically the Bush-era cuts and then the 2017 Trump tax package. Together, they add about $10 trillion.
And the most recent one, of course, the massive federal response to the pandemic.
Exactly. Suspect number three, the various COVID stimulus and relief bills, they account for about $5 trillion.
So if we add all that up...
Combined, those three undeniable massive events wars, tax policy, global pandemic response total about $23 trillion of debt created just since the year 2000.
$23 trillion is a staggering sum. I mean, it dominates every single fiscal debate.
It does.
So how does that number compare to this hidden culprit that the Taproot model is pointing to?
Well, if you put that $23 trillion against the Taproot finding, the scale just shifts dramatically. The model attributes $26 trillion solely to federal healthcare overspend.
$26 trillion.
Just from the amount overpaid compared to, basic economic reality.
Wait a second. Are you saying that the excess cost from these pricing failures in U.S. healthcare is mathematically larger than the combined cost of every major war, every big tax cut, and every pandemic relief bill of this century?
That is exactly what the model implies. I mean, think about the counterfactual history for a second.
Okay.
If the U.S. had paid the same prices for healthcare that, say, Germany paid over the last 50 years, and Germany's peer nation with the same tech night,
right,
the Treasury would have saved enough money that we could have still fought the wars, enacted the tax cuts, and survived COVID. And we would still have a lower national debt than we do today.
That completely reframes the entire challenge.
Mhm.
It's not that America can't afford its government. It's that it can't afford the prices from one specific industry.
And that brings us right to the most common counter-argument, demographics. Everybody says, well, of course costs are up. It's the aging population. The baby boomers are retiring.
It's the intuitive answer, for sure. More older people, higher costs. Did the analysis account for that?
It did. The analysis factored in two huge demographic changes: the U.S. population doubling since 1970 and the mass retirement of the boomers. And the math shows the crisis is not having more people to care for.
It's the cost per person.
It's the exponential growth in the price of caring for each individual person.
Okay, let's get granular on that. Give us the specific data on that per-person spending jump.
Sure. In 1970, the federal government spent roughly $63 per person on healthcare.
$63.
Now, if that $63 had just tracked the consumer price index, general inflation,
Right.
the government today would be spending about $525 per person. Manageable.
So what are we actually spending per person today?
Instead of $525, the government is currently spending $6,080 per person,
Whoa.
which means the U.S. is paying 11.5 times more for the same biological outcomes than inflation would dictate. This intensity gap is what the source calls the financial black hole in the American budget.
An 11.5x multiplier in one sector is, it's hard to fathom. It's not inflation. It's hyperinflation just in one industry. How did the system even let that happen?
The source identifies what it calls the triple multiplier effect. This wasn't one mistake. It was three specific forces that just stacked on top of each other over 5 decades, and that's what turned a predictable cost into a sovereign debt crisis.
Okay, let's break that down. Multiplier 1, the price tag.
Or the inflation gap. This is the core problem. The source uses this great milk analogy. A gallon of milk that should cost $8 today if you tie it to inflation is instead ringing up at the register for $60. We're paying premium luxury prices for what's basically a utility service.
And every year, Medicare and Medicaid just pay those prices.
They pay the bills, turning the difference into new debt immediately.
Which gets us to multiplier 2, which is the argument system defenders always use. The innovation excuse.
Right.
You can't compare 1970s healthcare to today. We have MRIs, we have robotics.
Right.
We're paying more because we're buying better stuff.
And it's a compelling argument, which is why the model addressed it head-on by auditing a control group. Germany. Germany, like the U.S., has MRIs, cutting-edge cancer drugs, all of it. They looked at Germany's healthcare spending growth compared to its own inflation rate.
So if the innovation claim is true, German healthcare spending should have also massively outpaced its inflation.
It did, but predictably. German healthcare spending grew at about 4.8% a year, while their inflation was 3.1%. The difference, 1.7%, is what you could call the legitimate innovation premium.
So that 1.7% is the global rate for medical advancement in a healthy market.
Exactly. And here's where it gets really interesting. The Taproot model then generously applies that same 1.7% premium to the U.S. budget.
It pays for all the new tech.
Pays for every breakthrough. And even with that generous allowance, the U.S. system is still overcharging by trillions of dollars. And get this, Americans actually go to the doctor less often and spend fewer days in the hospital than Germans do.
So we aren't buying more healthcare.
We are simply paying double the price for the same innovation.
Which suggests the problem isn't the technology itself, but the price tag that gets attached to it as it passes through the U.S. system.
It does. And that structural pricing gap, even adjusted for innovation, just keeps getting wider and wider. That gap is the debt.
Which brings us to the third multiplier. Interest. The silent killer.
The silent killer, yeah.
We didn't pay cash for that $60 gallon of milk. We put it on the national credit card.
And that's the compounding debt trap. It's the mechanism that turns inefficiency into a full-blown crisis. A huge part of our current $35 trillion debt isn't money we spent on doctors this year.
Right.
It's money we're paying to service the interest on the excess costs we racked up back in 1990, 2000, 2010. Waste compounded over 5 decades. It accelerates into a crisis.
Okay, let's address the title of this analysis, the $52 trillion total. The debt gap we've been talking about is $26 trillion for Medicare and Medicaid. Where does the other half come from?
Right, so that $26 trillion is public money, federal debt. But the federal government only pays for about half of the entire U.S. healthcare market.
The other 50%.
The other 50% is paid directly by private businesses, through employee health plans, and by American households through these soaring premiums and deductibles.
So the same pricing failures that drained the Treasury also drained the private economy.
Correct. For every dollar of waste borrowed by the government, a matching dollar was stripped directly from American wages and corporate profits. That's the private twin of the debt. Another $26 trillion.
So the total economic cost of this inefficiency, public and private, is $52 trillion.
52 trillion.
If the U.S. collectively spent $26 trillion more than it should have on federal health care, that money didn't just disappear. It went somewhere. Did the source track the money?
It did. The analysis compared the exponential growth of federal health spending, so Medicare and Medicaid payments, against the revenue growth of the private health insurance industry.
And what did they find?
The result is a near-perfect mirror image. It demonstrates that federal health spending and private insurance revenue are, well, structurally linked.
Meaning the U.S. Treasury is essentially underwriting the inflation of the private insurance market.
Exactly. The Treasury is basically a pass-through entity. It borrows money to pay inflated premiums and reimbursements, which are set and managed by these private intermediaries. It's borrowing to pay bills that are being inflated by market actors.
But the industry always pushes back on this, right? They claim they're low-margin businesses. They always cite these 3 to 5% profit margins. How does that square with this idea of a massive wealth transfer?
This is such a critical point. It's the low-margin myth. So, first, if you're in a percentage-based business, inflation is your profit.
How does that work?
Well, if an insurer takes a regulated 15% cut of a $1,000 premium, they make $150.
Right.
But if costs inflate and that premium jumps to $2,000, they now make $300, even though their profit percentage hasn't changed.
So they have a built-in incentive to want costs to go up because it increases their gross profits.
That's incentive number one. Incentive number two involves vertical integration. You hear these acronyms like PBMs, pharmacy benefit managers.
Right, the middlemen who negotiate drug prices.
Exactly. Insurers have spent the last 20 years buying up the supply chain, the PBMs, the clinics, the doctor groups.
Why?
By owning these entities, they can shift profits from their regulated insurance division, where margins are capped by law, to their unregulated service divisions like their own PBMs, where margins are unlimited. They're passing money into their own other pockets.
A closed-loop system.
It's a closed loop of internal inflation.
And this inefficiency is still consuming huge resources right now. If we look at the 2025 budget, what chunk of federal spending is just feeding this monster?
In 2025 alone, the excess healthcare inflation will eat up about $1.9 trillion. To put that in perspective, that's 27.8% more than a quarter of the entire projected U.S. federal budget.
A quarter of the budget.
Swallowed by this one structural flaw.
So what does this all mean? The political debate for decades has been stuck in this false dichotomy. We're told we have to either raise taxes on everyone or gut Social Security and Medicare.
Right, who pays the bill?
We argue over who pays the bill, but we never ask why the bill is so astronomically high in the first place.
And the data here strongly suggests the solution isn't austerity. We don't need to slash entitlements or impose massive tax hikes. The path forward is purely structural. We just have to fix the market failures that let costs defy gravity in this one sector.
The analysis provides a roadmap to break that triple multiplier. What are the key fixes?
There are three main solutions that come directly from the data. The first is to fix that perverse incentive structure we just talked about. They suggest repealing the medical loss ratio, or MLR.
The MLR.
Yeah.
Now, that was a law meant to protect consumers, right? It forced insurers to spend 80 or 85% of premiums on actual medical care.
It was, but it completely backfired. Because the MLR is a percentage, it mathematically incentivizes insurers to want the absolute highest premium possible.
Because 15% of a huge number is more profit than 15% of a small one.
Exactly. Repealing the MLR would remove the legal incentive for insurers to profit from cost inflation.
Okay, what's the second structural fix?
Number two, uncap medical residencies. For decades, we have artificially limited the supply of new doctors, which creates a bottleneck that just drives up labor costs across the whole system.
So more doctors means more stable costs.
Expanding residency slots to meet market demand would naturally stabilize physician pricing.
And the third solution is about competition.
Unleash association health plans, or AHPs. Right now, the U.S. health insurance market is broken into 50 different state silos.
Right, they can't really compete across state lines.
They can't. AHPs would let small and mid-sized businesses pull their risk across a national market, forcing real competition and breaking the geographic monopolies that regional insurers have now.
So if these structural reforms reconnect healthcare costs with reality, the whole fiscal crisis just largely evaporates. But the benefit goes beyond just paying down debt, doesn't it?
Absolutely. The U.S. would regain massive fiscal capacity. The entire debate about a Social Security crisis just disappears, not because we cut benefits, but because the underlying economy finally becomes efficient enough to honor those promises. We stop paying that silent $26 trillion
That
tax.
structural change could unlock tremendous economic potential.
And, that leads to a final thought for you to consider. That $26 trillion in waste that became federal debt and the other $26 trillion stripped from the private economy, that represents a vast capacity that was just sacrificed.
Hmm.
So think not just about paying down debt, but what transformative investments in infrastructure, R&D, education, clean energy, what did the U.S. economy give up by letting this inefficiency go on for 5 decades? What kind of nation could we have built with that capital?